Hi, students. We are going to go through the neoplasm assignment. With that, we're going to start with case number 1. We have a 65-year-old male patient. So if I start putting everything in my encoder, admit date 1/3/2024, discharge 1/5/2024. So it's really important you have the dates and the years correct. Okay, so I'm going to hit continue. Disposition, the patient went home. The admit diagnosis. We can go ahead, let's go ahead and look at the documentation. They came in because they were coughing up blood. It was reviewed as an outpatient, but then they got admitted. So there was no documentation that there was any nicotine consumption. They do have chronic emphysema. At this point, they were admitted for inpatient because they're going to do some tests. So here they did a bronchoscopy. They did the washings and brushings. They did an aspiration. And the reason they did it because of the coughing up blood. So once we go down here, they did all this. You can read through the procedure. But the final diagnosis is going to be Oat cell carcinoma. They figured out that the patient has cancer. Okay, it's of the left upper lung, and they also have emphysema. So my principal diagnosis is going to be the cancer, and then my secondary is going to be the emphysema. Now keep in mind a couple of different things. When doing this, you are not going to code the coughing up of blood. That is going to be a sign and symptom of the cancer of the lung, so you do not code that. All right, I'm going to plug everything into the encoder. And a couple of different things. You were given some hints here on drainage for your root operation for the procedures. And I tell you right here, the excision extraction would not apply as a piece of the body part is not being removed. So that's a big hint there. All right, as I plug these codes in, I'm going to bypass the admitting diagnosis. You can go ahead and put it in, but if you do put it in, make sure you also, if you put the principal diagnosis and the admitting diagnosis, your MSDRG is going to be completely off. So make sure you remember that when doing your coding. So we're going to go ahead, we're going to get that cancer code in. And then we're going to go ahead and put in the emphysema, which is going to be our J43.9. Hit OK. Now we're going to put our 2 procedures in. Okay, so looking at this, I have everything put in. Go back to my encoder. I have MSDRG of 182. Your next question asks you for the relative weight, and that's going to be the 0.7988. All right, it's really important. You may not come up with these answers if you did not put your principal diagnosis in the correct area, or if you did not have the correct procedure codes. As you can see, the root operation on both of these are going to be drainage. Okay, so go ahead and double check this one. If you have any questions, let me know. I'm going to go on to our next patient. With that next patient, we have a female, age 71, and we have admit 817 and discharged 115. Okay, I just went ahead and coded this case out. We have a lot going on. We are going to start off here with the principal diagnosis as malignant neoplasm of the left ovary. As you see, I did go ahead and put it in as the admit also, which is fine as long as you still have it as the principal diagnosis. Then we have a secondary malignant neoplasm of the retroperitoneum and the peritoneum. Okay, so we have quite a few procedures. They resected the ovaries, the omentum, the uterus, the cervix, and the fallopian tubes. Everything was done by open approach. Remember, and then they did excision of the vagina. A couple of different things you need to remember on this root operation. Resection means that they took it all out, where excision they probably took just partial vagina out. All right, so let's go ahead. MSDRG is 737. The weight is 1.9738. All right, case number 3. With this, when you look through it, I'm just going to kind of briefly talk about it since the general answer comments are pretty explanatory. We have lymphoblastic lymphoma of the lymph nodes, CA 3.53. Remember, this patient's a female, 55, 1/7/2024 to 1/12/2024. They took out the spleen. With that, we do not want to, I've had some students go ahead and add the R16.1, which you do not want to do. Let's pull that up real quick. That is going to be R16, sorry about that. The R16.1 is going to be a splenomegaly, okay? Keep in mind the reason that the spleen is large is because they have the lymphoma. Okay, it's going to be a sign or symptom of that, so we do not code it. All right, so then we get into taking out the spleen, the resection. Took out the whole spleen. We did take out some lymphatic excision of the mesenteric lymphatic. And then our DRG and relative weight is 822, 1.2388. Anybody has any questions on this, please let me know. I'd be happy to help you.